I think that teamwork at Michigan it's almost a cliche, but it is a cliche because it's true. I feel like it's a pervasive sort of attitude. People here are just kind and willing to work together and know that our primary focus is never just one person or their personal goals, but rather what we can accomplish as a team, and I think that's the best way to work.
CS Mott Children's Hospital is the premier children's hospital, and we're part of that great institution. Pediatric Urology is part of that culture that constantly strives for excellence. Our department is one of the top urology departments in the whole country in both in terms of quality of care, resident education, and the research. My job as a division director is for everyone to really fulfill that calling. And in order to do that, we need to work together as a team. And I believe that that's what we do here.
The most important thing that drives me to come to work every day is just working with folks that take as much pride in treating patients as I do and working together collaboratively.
We're all running in the same direction, we're all pulling together. I think it's mostly because from the very beginning it was stressed that our fundamental thing we always want to keep in mind is that we want to be here for the families and the patients and take good care of them.
Family-centered care is critical in pediatrics, much more so even than in adult medicine, because you can't take a child out of the context of their family. Everything about their life involves their parents, their siblings, their caretakers, and so you have to really respect and understand that to take care of the child well. So I have a bunch of kids at home, so I know what it's like when you have to focus on one child and the other children still need their needs met. Similarly here at the hospital, when I'm trying to examine a baby and mom is very worried and has questions because she's concerned about the surgery we're going to do, one of our nurses will come by the clinic room and take the other kids out and have them go blow bubbles or play with toys or entertain them somehow so that mom can focus just on the baby and getting her questions answered.
Our pediatric urology nursing team is a team of 4 nurses. We've worked together for many, many years, and we all have children. We've all had children who are sick. So we understand when the parent calls or they come in and they're that concerned parent. And we truly try to approach every parent as if we were calling, as if it was our child that was sick, so that we can support them and we can educate them and make them feel like they're really, really, being cared for and listened to. One of our recent nursing projects was PUPPY, and PUPPY stands for Pediatric Urology Perioperative Patient Initiative. And it was developed to try to improve the education we do with our families whose children are undergoing hypospadias surgery. We meet with the families while the child is actually in surgery. We find that this is often a stressful time for the families, and they're very nervous. And so we sit down with them, we go through our educational pamphlet, and we use a hands-on teaching tool to help them understand what the dressing will look like once they take their child home.
We have a wonderful program here at the University of Michigan that urology took a great part in establishing here a few years ago. DSD is unique and is a great example of our respect and the teamwork because it is a rare condition where the right answer is not always apparent. The DSD stands for a condition called Disorders of Sex Development, and it is a truly interdisciplinary program where everyone works beautifully as a team. It is represented by urology, pediatric surgery, gynecology, endocrinology, plastic surgery, ethics, child life, and behavioral pediatrics and psychology.
Every Friday, for the 25 years I've been on this team, we have a multidisciplinary meeting that is our pediatric urology team, which is made up of our physicians, our nurse practitioners, our nurse coordinators, our residents, our fellows.
But it is truly a robust conversation where we talk about challenging cases, but our focus is on the patients, how to solve the problem for the patients. Everyone brings a perspective that is truly unique and valuable, and by working together as a team, and that we function as leaders to make everyone else around us better, that is the only way to provide the best care possible, and we're committed to that. And I think that they can count on receiving the care when they come here.
At Mott, I feel like taking care of patients really means taking care of them. So not just treating their medical needs and treating them as a patient, but also respecting their family, also respecting their family's values and their choices in medical care for their child, and loving that child and taking care of them as if they were your own.